Really great honor to be here. Thank you for having me. I'm really excited to talk about actually one of my favorite parasites. When they said, what do you want to do for the conference? And I was like, ooh, Giardia, that's great. So I'll try to control my enthusiasm. I know you guys just had a big lunch, so hopefully I can give you some of my zest. So without further ado, we got a lot to cover, so let's take a look at Giardia for shelter staff and veterinarians. So first of all, think in your mind, when I say the word Giardia, what do you think of? What is the clinical picture? What do you think, for humans or animals? And, sorry? Oh, yes. I'm like, diarrhea, absolutely. So, but of course there's more to it than just the clinical picture. What is Giardia in a grander scheme? So think about that, and I'm going to ask you the question again in 20 minutes, and hopefully we will have clarified some issues. So Giardia is a protozoa parasite that lives in the small intestine. And you can see here a little teardrop-shaped protozoa on the slide. And as you guys already know, or may you know, diarrhea, that's what we think of. So gastrointestinal disease in dogs, cats, and humans. So this is a zoonotic disease which affects humans and other animals. And I just Googled Giardia outbreak, and look, I got one really close to here really recently. So it's an important zoonotic disease that affects humans, and you're going to see it in the news. But of course, in the shelter setting, we're thinking more about cats and dogs, and unfortunately, it is a very difficult disease to diagnose and to treat in that setting. So we have two varieties of Giardia, which we're going to think about. We're going to think about the adults. So these are the protozoa which are in the small intestine. They're the ones who are causing disease, and one of the reasons why they're my favorite is because I think they look like little smiley faces. I don't know. So, I'm not great with all the other eggs, but if I see a Giardia, I know what it is. It's smiling right back at me. So the other form of Giardia we think about is the cyst. So these are quote-unquote eggs, which are in the environment, and these are what are infecting the other animals in the shelter. And coincidentally, I kind of also think they look like little smiley faces. I don't know if anyone else sees that. So, in order to treat Giardia effectively in the shelter, we need to know a little bit about its life cycle. So very simplistically, we begin with a cyst. So cyst in the environment, it's going to infect our host, which is our cat. One way or another, this cat is going to ingest the cyst and become infected. Once inside the cat, we are going to have the cyst mature into the adult protozoa, and it's going to make little friends, and we're going to cause disease, and we're going to keep multiplying and producing more Giardia. At a certain point, we're going to start producing more cysts. They're going to start reproducing, and they're going to go out in the feces, in our diarrhea. So these cysts are going out back into the environment and are going to be able to infect more animals. So as we've already mentioned, transmission is primarily what we call fecal-oral, or poop-to-mouth in layman's terms. So somehow these animals are eating things which are contaminated with feces. So this can be through food, through water sources, very importantly in the environment. So I've got a picture there of some puppies out in a play yard. They're going to have cysts in the dirt, it's going to be on the wire, it's going to be on all the food bowls, etc. And it's going to be on the equipment. If we're moving things between cages that can possibly be contaminated, that's another great way to spread your cysts. And also shown in this picture very well is through fur and grooming. So the cysts come out in the diarrhea, they're going to stay in the back ends. If dogs are walking in it, it's going to be in their paws. If the cat goes around to groom itself, it's going to be licking up those cysts and reinfecting itself. So, as I mentioned, Giardia is a potentially zoonotic disease, so this is important for us to think about ourselves and the staff members. So the main species of Giardia which we're talking about today is Giardia duodenalis, and it has several subgroups which are called assemblages. And different ones have different zoonotic potential. So some infect humans and some don't. A and B assemblages are the ones which can affect animals, cats, dogs, wildlife, livestock, etc. So these are the ones that we're worried about to potentially cause disease in humans. Assemblages C and D are specific to dogs, and F is specific to cats. So these are ones we're not so worried about. So now the question is, we have an animal with Giardia, how do we know if this is going to be a zoonotic issue in our shelter? And unfortunately, the answer is we don't know. because we only can find out what assemblage an animal has if we do DNA testing at the laboratory, and this is something which is expensive and time-consuming, and most shelters are not going to be doing this on a routine basis. It's just the reality. So the risk, and I've looked at a few papers on the subject, and it looks to be maybe half animals are carrying potentially zoonotic forms of Giardia. Whether or not it actually goes on to infect humans is a different issue, but some studies have shown that there actually might be a lot of animals your pet cats and dogs could be holding a zoonotic form of Giardia. So going on for a bit more studies, in the United States, there are a couple surveys looking at pet cats and dogs, and the prevalence, or how common the disease is around 4 or 5%. Fast forwarding to shelters, we can see that the prevalence is a lot greater. Same thing for kennels and catteries, just animals housed in group conditions with issues of hygiene and sanitation. Obviously, we're going to have more disease. But of course, it's going to vary where your shelter is. What are the age of the animals that are infected? What are your protocols and your husbandry procedures for your shelter? That's really going to impact how much disease you have. So, a couple quick risk factors for Giardia infection. We most commonly see it in young animals. These are animals under 1 year of age, and in adults it's less common because we think they get an acquired immunity, so they already have antibodies and they're able to fight off the Giardia. So we're really looking at young animals for this disease. And the presence of other diseases. Quite often in our shelters we see young animals that have a variety of parasites, roundworms, other protozoa, etc. And these are going to make your clinical disease much worse. It's not just the Giardia which is causing them to have diarrhea. And very importantly with Giardia is a seasonal pattern. So when it's wet, rainy, and cold, autumn and winter, that's when we're going to see more disease because the cysts live happily in puddles and in wet environments, and they're not going to be killed as easily. All right. So clinical signs, you guys already nailed it on the head. We're thinking about diarrhea. So inappetence or anorexia, weight loss, kitten that's not growing so well. These are all classic clinical signs. We also can see vomiting, but it's less common. But what I need to draw your attention to, which is very important, is many animals with Giardia have no clinical signs. So these animals are asymptomatic, they are infected, and they are potentially shedding and contaminating their environment, but we don't know just by looking at them. So now that we know a little bit about Giardia, we need to go on the manhunt. How are we going to find it? And the classic way for looking for Giardia is through a microscope of fecal samples. And we need to do our examination with a special zinc sulfate flotation, which is not the normal way we do flotations. If any of you have been involved in doing a little microscopy in your shelter, it's not the normal way we look for parasite eggs. So it's a special solution. The cysts are very small. They can look like yeast and are very delicate, which is why we need the special solution. Otherwise, we might not be able to find them. So basically, what it is, we need experienced personnel to look at these slides. Not just anyone can go with a fecal sample and go to the microscope and find Giardia. And the other really important point I need to labor is that even if we go and get the sample from the animal that's sick, they may not have cysts in the feces at that particular moment. We need to go and get another sample and another sample. And we recommend at least 3 samples over the course of several days, so we're screening multiple times to increase our sensitivity and likelihood that we'll find one of those cysts. So here's a brief, actually quite an unusual slide, now I'm thinking about it. The trophozoite, which is fancy word for adult Giardia, and one of the cysts. And usually we're just looking for the cysts on the slide because the adults don't survive well in the environment. It's really the cysts that we're concerned with. So that just gives you an idea what they look like. And if you've ever looked for other parasites under the microscope, you might recognize some of these eggs. So we have the roundworm, the whipworm, and the hookworm. Massive compared to the size of a Giardia cyst. So if you don't know what Giardia looks like, if you're not looking for it, you can see how easy it would be to miss on a routine examination. So what other options do we have for diagnosis? Since clearly looking under the microscope, maybe not the best solution for everyone. Luckily, we have the Magic Snap test, and I'm sure most of your shelters have used Snap tests, and it's just like all the other Snap tests we use. It's looking for a special protein in the feces that's going to be present whether or not the animal is shedding cysts. So that's really great for us. And so it's much more sensitive. We're more likely to get a good result using the SNAP test. And there are other lab tests available. There's immunoassays and the PCRs, but for most shelters, this is what we're really gonna be dealing with, is the microscope and the SNAP test. But just remember in the back of your mind, there are other options. Okay, so now we are diagnosed our animal with Giardia. Now what are we gonna do? We're gonna treat it. So first question we have to ask is, who are we treating? And if we have an animal which is clinically ill, we snap them, we get a positive, yes, we're going to treat them. What if we have done a fecal and we found Giardia but they're not sick? Are we still going to treat them? If the animal is housed, you have 5 kittens in a cage together, one of them comes up positive with Giardia, are we going to treat all the kittens in that cage? Yeah. I see some nodding in the back, very good. All right. So what I really want to labor is that our treatment is aimed to resolve the diarrhea. We want the animal clinically healthy so we can get them out to adoption or just out of the shelter. We don't necessarily want to make them SNAP negative. We don't necessarily want, or not want, but we're not necessarily going to get rid of the Giardia. And that's something really important to keep in mind. All right, so favorite choice of drug at the moment is fenbendazole, or you may know it as Panacur, which works in cats and dogs. Easy, give it once a day for 5 days. Pretty good results to resolve clinical signs, lessen the diarrhea, get rid of the Giardia. Another option, which some people have been experimenting with, is fobantol combination products, also known as Drontal Plus, which is licensed in dogs, but some people have been experimenting with it use in cats, and they have been some success. Another popular drug that people use for Giardia is metronidazole. And it's gone out of fashion recently because high doses can cause neurological signs, can cause birth defects, and shouldn't be given to nursing mothers. And of course, Giardia can become resistant to metronidazole. So you can see how that would be a problem. Resistant Giardia, people keep increasing the dose, and suddenly you have all these adverse effects. So now that we've done our drug protocol, we need to focus on the rest of the animal and the rest of the shelter. So unfortunately, this means bathing our cats. So we need to prevent reinfection. All the cysts that are stuck in the fur, we need to get them out. We got to wash our cats and dogs. We have to clip them if they're going to be matted or getting really dirty in their hind end. And we need to clean the environment. So whatever cage they're in, we got to make sure that, terribly sorry. We're going to move them to a clean environment. So we're going to move them out of the space where they were infected with Giardia, where all the cysts are in the environment. We're going to move them into a clean cage. So they're not going to be licking the walls and getting more cysts. We're going to be promptly removing the feces in that new clean environment, because even though we're treating them, they still could be shedding cysts. If they step in it, contaminate their food, it's just going to make the process harder. They're going to be reinfecting themselves. All right. So now we need to deal with our original cage, which has been contaminated by all these feces and the cysts. So first thing we're going to do is we're going to scrub. We're going to physically get in there, manually remove as many cysts as we can, just soap and hot water, and get rid of what we can. We're going to remove our soap, we're going to rinse it out, and let it dry. And the reason why we're doing these first 2 steps, getting rid of all the gunk and newspaper and whatever's left in the cage, and drying it, is so that our disinfectant is more effective. And the disinfectant of choice that we're using is a quaternary ammonia compound, or quats, and those are some brands you might be familiar with. And these have been proven to be quite effective at getting rid of the cysts. So the cysts that we haven't scrubbed out, that should be killed by the quats. All right. And we want to make sure we have a good contact time. We want to make sure we leave that quat on there for at least 10 minutes, check the label, whatever product you're using, because we really want to make sure we're killing all those cysts that are residual still in the cage. All right. We're going to wipe it clean, and then finally, most importantly, we're going to dry it. So cysts, like I said, they live in the winter, they live in the wet, they live in the damp. We need to get it dry so we can desiccate those cysts, make them so they're no longer infective. They can survive for weeks or months in a damp environment, so we really need to keep that in consideration when we're cleaning our cages. You can't just hose it down and shove new animals in. All right. So this is a picture from a shelter in New Zealand where I did a couple rotations where they had chronic Giardia and other parasite problems. And you can see, where is this animal housed? Wood. Is it indoor or outdoor? outdoor. And I'll tell you, New Zealand has about as much rainfall as Seattle. It's always wet. So this dog is in a place that they're never going to be able to clean this kennel, right? It's going to be always contaminated with these cysts, no matter how hard they try, just because of the nature of wood and being outdoors. All right, so now we've treated the individual animal. We need to think about everyone else who could be affected by the Giardia. So what we need to do is prevent the spread throughout the shelter to the other animals. So we're going to place appropriate signage. We're going to put a big old sign on the cage, say, hey, I have Giardia, wear gloves, wash your hands. Ideally, limit handling to those who know about Giardia, know the zoonotic potential, and know how to handle it so they're not spreading it throughout the shelter. So not every volunteer should be cuddling the Giardia puppies. We need to have appropriate cleaning protocols, and this applies, of course, across all the diseases we're dealing with. If we have good protocols, we're going to be eliminating all the different diseases, not just Giardia. So picking up the feces, keeping it clean, we're preventing reinfection of all the diseases, not just Giardia, and we're going to allow the cages to dry before we add animals again. And we're going to keep the animals separate. I'm not saying you have to isolate them. You know, this isn't like upper respiratory where they need to go into a separate room necessarily, but we don't want to mix them. So if the puppy with Giardia goes out into the play yard, and then you have all your other dogs come out into the play yard, what's that going to do? That's not going to be helpful for your treatment regime, because they're going to be contaminating that environment. They're going to be contaminating the community cat room or the hallway where everybody walks. So you need to be conscious of where you're taking these animals and what other animals have access to that space. And of course, we don't want to be mixing animals, especially litters. You don't want to be putting sick animals in with the non-sick ones. It's common sense, right? So because young animals are more easily infected, or at least more commonly, we see them as clinical disease in the young animals, we want to keep them in easily cleaned cages. We don't want to put them into the nice posh cat room with all the furniture. We want to keep them somewhere that we can clean in case they do get sick. All right, so already touched on this. What are you going to do when one of those cats starts having diarrhea? We snap test it, and it comes back positive for Giardia. Yeah. Yep, so we're going to get rid of all the furniture that we can't clean, all the carpeting. We're going to get rid of all those toys, all the blankets. And it looks like in this picture that they have cardboard little hidey holes. Great, because we can throw those away. Cardboard hidey holes, cardboard litter boxes. These are things we can get rid of. It's not a great cost. We're going to be treating that one particular animal, and we're probably going to be treating all the other animals in that environment. Because even though they don't have diarrhea, they've been exposed. Chances are they could be asymptomatic but still infected. And of course, we're going to be putting up signs on this door. This looks like probably is an adoption area. So we want to make sure that everyone knows what's going on in this room, and we're not just tracking Giardia in and out. So what about this? There's a few interesting things in this picture. There's a pool, a very nice swimming pool for the dogs. There's a wooden pagoda, and there's gravel. Gravel's not as bad as dirt and grass, but I'm sure you can imagine if a dog with Giardia defecates in that yard, that gravel's contaminated. How are we going to contain that? And same thing with the pool and with the wooden pagoda. How are we going to contain that? We might end up having to resurface our play yard, and that's not something anyone wants to do.
Is there any type of treatment where you can treat the yard?
That's a very good question, and I'm hesitant to give a direct answer to that, because I guess it depends. You know, if the animal goes to the bathroom right away and we're able to pick it up immediately, is all the soil around it infected, or has it been chronically infected with Giardia and all the dogs have been kicking up the dirt, and it's that we have layers and layers of cysts in the soil. And I'm not aware of any recommended protocol really for that. Unfortunately, some situations you just can't get around it. All right, resolution. So we come back 2 weeks later after we've been treating our animal, and we're going to do a snap test again or look under the microscope again. If the animal is still sick, we're going to still treat, no brainer. But we need to think, why did our treatment fail? Why did the animal potentially reinfect itself? Did we not sufficiently clean it? Did we not keep their environment clean? Did we put them in an environment which has cysts still in it? So we need to keep these things in mind, because reinfection is more common than treatment failure. We might want to consider a different drug protocol if we think we didn't use the correct dosage or the right amount of time for the drug to take effect. And we also need to look for other causes of diarrhea. Like I said, Giardia might just be one part of the problem. The animal might have some other issue, other parasite, which is causing the disease, and we need to make sure we've ruled those out as well. All right. So now we have to think about adoption. If we have an animal, we've treated it for Giardia, it's come back, it's healthy, but it's still SNAP positive. What do we do? So we need to weigh the pros and cons and how we're going to tackle this adoption. So, of course, always in the back of the mind, we're thinking we're adopting out an animal that has a potentially zoonotic disease. And what does this mean for our adopters? We need to remember that immunocompromised humans are at risk. So people with certain diseases and children, these Giardia can be very life-threatening for them. So we need to consider what kind of home we're placing this animal in. And many shelters have chosen to do a waiver. Of course, client communication and education is very important. We're going to have someone sit down with them and explain, you're adopting an animal with Giardia, and this is what it means. We can have them sign a waiver to help negate some liability on the shelter's behalf. But as you probably can figure out, there's no great way of completely reducing the risk. And as another side, it also is important, if you're adopting out a cat with Giardia and you're adopting it out to the nice old lady who has 6 other cats, what does that mean to her whole household? You know, is that going to be repercussions down the road that you're going to feel quite bad about if she comes up with a bunch of sick cats? Okay, so I asked the question, what is Giardia? And now, in your mind, I'm hoping a few more light bulbs are going off. It's not just diarrhea, right? So, it's a common disease. Dogs, cats, humans, and other animals, we need to be aware, have Giardia. It's a challenge to control, depending on what kind of rooms your animals are housed in, what kind of cages, what kind of sanitation protocols you have. So control really depends on how you're taking care of your cleaning in that shelter. And always just remember, animals which are healthy could still have Giardia. Animals which you treat could still have Giardia. So we need to consider the risks and decide what is best in our shelter situation for how we're going to deal with this problem. All right. If you like some light reading, I can offer some excellent references. And so that's the end. I'd like to thank Maddie's Fund and the SPCA and Cornell University for having this talk and for having me. And I'd like to open up to any questions you guys might have.